Hello, good afternoon, everyone. Thanks for joining our webinar. Some of you may recognize my voice. My name is Mark Ayre. I'm Director of Customer Operations here at Brightsquid Secure Communications Corp. Today's conversation is around easy patient engagement, and we thought that this topic was quite timely given that we found that a lot of our clinics that are using Brightsquid Secure Mail are definitely using it to engage with their patients, but we found through some of our data research that there's still a good number of you out there that are using Secure Mail primarily or exclusively for clinic to clinic communication. And I feel that we're kind of missing one of the key value propositions of Brightsquid Secure Mail, which is the ability to better engage with patients, better connect with patients, and satisfy patient expectations. To be quite frank about it, we'll wrap up today's conversation with a very quick demonstration about how the panel messaging service that was recently introduced to Brightsquid Secure Mail would allow you to send a bulk message to potentially hundreds of patients simultaneously, and then at the same time invite all of them to join Secure Mail so that you're not doing it one at a time. The reality of patients is they're not always thinking about their healthcare or always in a position to be having a phone call or a conversation or a physical trip down to your location to deal with healthcare. So they're expecting a secure communication system to be available to them so they can communicate and stay in touch with their doctors. And these are actual quotes that we had come back to us. They've been edited for privacy purposes, obviously, but these are the quotes from patients about what their experience with Secure Mail has been and some of the things that they like about it. I really relate to the second one that says I had surgery while my spouse was working in another province, so traveling to follow-up appointments was difficult. Um, that seems like an obvious one when you stop and think about it. That it's important to be able to keep in touch when we're traveling. We have secure mail users all over the world that still need to communicate with their doctors who may be in a different province or even a different country. It's not uncommon. The bottom one, I think, is the most relevant one or the most resonant one, perhaps I should say. I'm here in my office 9 to 5, Monday to Friday. And if a clinic tries to phone me, I'm not at home, so I don't get those phone calls. It can be difficult to take time off work to get to the doctor's office, but it's helpful to be able to send a secure message or receive a secure message from my doctor or other healthcare provider to just have a touch base on an ongoing issue, whether that's a chronic medical concern or just something very simple like here's a list of all the things I ate last week because I'm seeing a dietitian, for example, or even a question about my medication. Dear Dr. Jones, I've been taking this medication and now my fingers are swelling up. Is that normal? Should I come in and see you? Maybe you should. Maybe you just change the dosage. Those kinds of things can all be managed through Secure Mail. Now, the appreciation, this is sort of a maybe a little bit self-aggrandizing, but these are the kinds of things we've also heard back from patients about how Secure Mail made their lives better, faster, more convenient. And I think all of these speak to the idea of convenience for patients. It's so much easier no, gosh, this makes me sound so old. In this day and age, to be able to communicate over my mobile phone with my doctor's office sort of seems like it should have been available 10 years ago. And now that it is, we see patients really appreciating that that opportunity is there. And my last slide to self-aggrandize and pat myself on the back is some of the responses that we've heard from clinic managers. The response from patients has been phenomenal. Secure Mail improves our standard of care. Confidentiality is so important. Every jurisdiction, it seems, from Alaska to Alabama and everywhere in between, Alberta, Saskatchewan, Manitoba, BC, all of those locations are tightening their privacy requirements, and Secure Mail meets and exceeds all of those regulations. So the ability to have an email type of conversation with a patient is something, like I said in the last slide. Patients just tend to expect that, and when they finally have the opportunity to communicate securely with their doctors and medical providers, or just the clinic in general, it's much appreciated. It makes everyone's life better and faster and more convenient. And that convenience factor, I think, is top of mind when we think about some of the stresses our healthcare system is under right now, Being able to, even save a minute or two a patient can add up to hours of saved time in a day, a week, or a month. How does secure mail really work? Like, what are the real world examples as to what you can do with secure mail to improve not only your own lives in the clinics, but how are you making life better for your patients? And right at the top, this was an easy one to make a decision on. The most obvious one is preparing patients for their appointments ahead of time. Now, some of you may know that we do offer an automated appointment reminder service. Depending on your EMR, we can integrate directly into your system to send automatic reminders to your patients through a combination of email, SMS, and secure mail messaging. That's not actually what I'm talking about here. This is basic appointment preparation information that you can send to your patients through your secure mail systems, unintegrated, just kind of a manual message that you'd send to your patients that would educate and inform them before they show up on your doorstep. The quote under there, we can see if patients read an appointment reminder, which helps with no-shows because they often say they didn't get the message. Most of you probably know that whenever you send a secure mail message to a patient, you can look in the sent messages folder and find that message and see if they opened it. We'll actually even show you the exact time and date that they read that message. So that can be really helpful if you hear from a patient on a no-show that says, oh, well, you didn't send me a reminder. We did actually. Getting away from the mechanics of it, the actual things that folks are sending are forms and documentation and instructions ahead of time. You all know how you can send attachments through secure mail, whether it's a PDF document, an Excel spreadsheet, or a photograph, or what have you. Send forms to patients and have them fill them in and send them back. Send forms to patients, have them fill them in and bring it with them. In either case, it prevents that problem of patients sitting in the waiting room with a clipboard and a pencil, filling in a form in messy handwriting, and having you then transcribe that into the EMR. If they send you back a filled in PDF, you can drag and drop that into your patient record system, and it's done before they even show up in your at your office, which can be very helpful to not only the clinic staff, but the physicians who would then have the opportunity to review that information before the patient even arrives. Instructions. I don't know how often you get phone calls from patients the day before or the day of their appointment saying things like, I'm not sure where you're located. Where do I park? What should I bring? Can I bring my child, my dog, my brother-in-law? Those kinds of questions can all be answered by sending the documents and the frequently asked questions and answers to your patients ahead of time. Again, this is something we can do through the automated appointment reminder service, but you can also send them manually. Just have a template and send those messages to your patients the day before or the week before their appointment. So they're better informed and it reduces the inbound phone calls to your clinic because being on the phone is what takes up the most time. And if we can eliminate even 25% of your inbound phone calls in a day, think how much time that would save you and how much more time you could spend on more relevant tasks. Of course, after preparation comes follow-up. Patient comes in, they see the doctor, they get instructions, and then they go home. And if they're anything like me, most of them forget exactly what they were told when they were sitting with the doctor. And again, not to get too much into my personal life, this very much describes me. When I go to the doctor or I take my son to his doctor, pardon me, and I'll get home. And of course, my wife asks me, okay, what are we supposed to do here? I've probably forgotten or remembered it incorrectly. So it can be helpful to have a document sent to the patients after their appointment that says, here's what you discussed with Dr. Jones, and here's what you should do. How to use your medication that's been prescribed and things like that. Again, all of this can be templated. So just like the preparation on the previous slide, you can create your own custom templates within Secure Mail so that you're not manually typing out the message that you're sending to your patients after their appointment. Those templates can also include attachment. Educational material is a really good example for that. So after a patient comes in, if they're diabetic, they get the diabetic follow-up information and the attached educational brochure as a PDF document is built right into the template. Patient can then receive and download that information and refer to it from the comfort of their own home. Also a good way to send requisitions. I've left my doctor's office with requisitions more than once, and by the time I got home, elves had stolen it from me. So I had to call the clinic and have them resend the requisition to me, which is really helpful for someone who has elves stealing things out of their vehicles. Um, Surveys at the bottom there, this is something that we're seeing more and more of, is sending patients some satisfaction surveys after, once a month, once a year, whatever works for you, inviting your patients to take a survey so they can give you feedback on how your clinic's working well and what things you could perhaps improve upon. Billing and insurance information that's sent to patients. There's often a tendency among some clinic managers to try to qualify what counts as private healthcare information. Is it okay to send this information through regular old-fashioned email because it's not really that sensitive? Is it okay to send this information because it's not really that sensitive? And the truth of the matter is that's not up to us to decide. All information that's collected about your patient, from their name and their age to their specific healthcare concerns and healthcare history, is all sensitive healthcare information and should be transmitted through secure mail. So when it comes specifically to things like invoices and receipts or payment information or insurance data, all of that should be transmitted, must be transmitted through secure mail. You can't send an invoice to a patient that includes the procedure or the process that they went under when they're in your office, because that clearly has healthcare information on it that must be protected. And unfortunately, we do still hear these stories of clinics that, despite having secure mail at their disposal, are still sending this type of information through regular old-fashioned non-secure email. So billing information, insurance data, all of this contains that sensitive demographic information, all of that information that needs to be protected and kept secure. Brightsquid Secure Mail is one of the only secure messaging systems that is compliant with the healthcare regulations here in Alberta, where I am, but also across every province and territory in Canada, and meets the compliance requirements for the HIPAA regulations in the United States. And the privacy compliance afforded by Secure Mail helps to protect your patient's information, your practice, by avoiding and preventing the breach of data. It allows for a complete communication conversation. So what I mean is, phone, as I mentioned earlier, is a very intense way of communicating information. It requires coordination between two or more people to both be on their own phone at the same time so they can share information. And oh my goodness, is that difficult in some cases. Secure mail is asynchronous. So I can send a message to someone on Tuesday at 3 in the afternoon and they can read it at midnight that night. I mean, that sounds obvious and kind of remedial when I say it that way, but when you think about how difficult it is to coordinate two people to be on the phone at the same time, if you don't need to do that, why would you? Cybersecurity, because of the way Secure Mail works, we have vetted our users. There's no one on our system sending ransomware or spam. You're never going to get an ad for a new BMW through Brightsquid Secure Mail because all of our users and our subscribers and even our patients have all had a verified identity process so that we can keep those bad guys out. You can recall messages with secure mail, which you can kind of do with traditional old-fashioned email, but honestly, it doesn't work that well in email. With secure mail, because we at Brightsquid control the entire chain of custody of the message, if you ever do send a message to the wrong Mark or the wrong Jeff or the wrong Bob, you can immediately recall it and pull it back out of their inbox before they've even read it. And as I mentioned before, there is those read receipts, so you can tell if someone read a message. So if you send it and then immediately recall it before they've read it, no harm, no foul, and no data breach has occurred. You can save the amount of paper you use. And again, this is one of those somewhat pedantic, somewhat remedial sounding benefits of secure mail. But if you consider the amount of paper and inkjet ink that goes into your printers and postage and things like that, if you could save one box of paper a month, that's about the same cost of a secure mail subscription. And you're already subscribed to secure mail, so why are you spending all this money on paper and printer ink? So you can reduce the amount of money that you spend on those consumable products for your office. Now, a little bit about expectations. Brightsquid Secure Mail, as much as I love it, and I think about Secure Mail 24 hours a day, 7 days a week, even when I'm sleeping, I know not all of you or all of your patients are quite as enthusiastic as I am. But the honest truth is, our Secure Mail messaging service is one of the most reliable and most accepted messaging systems that we've ever that I've encountered anyway. Our messages, our email notifications that go to your patients get delivered with a 94.5% reliability. So that means when you send a secure mail message to a patient, it's going to be delivered to their inbox. We don't get spam blocked because we're very secure and have a high reputation, so we don't have much problem with spam. Honestly, the only time the messages don't get delivered is typos in email addresses. So double check that, mark at fmail.com is maybe supposed to be Gmail or Hmail or Hotmail or whatever. Double check your email addresses, make sure that they're correct. Confirm with your patient. And when you do send a message to a patient to invite them to secure mail or either as a follow-up message, we're going to send them 3 reminders if they don't open that message within the first day, week, or month. So we work really hard to make sure that our messages get through. The actual open rate for the secure mail message is around, I want to say 90%, but Jeff makes me say 89.6%, which is way higher than you'd get with a regular email campaign. Now, honestly, we can't take all the credit for that. Patients are more likely to open a message that's coming from their doctor's office than a message that's coming from Bath and Body Works or some other marketer, for example. So make sure that when you're sending messages out to your patients, that your clinic profile properly reflects your organization. I have seen more than one clinic whose practice name is just doctor's office, when it really should be something like ABC Family Medical, because that's what's going to be shown to the recipient when they get that email notification in their inbox. So be careful, and I'll show you that if you're interested. I can show you where that all is set up in your secure mail account so you can make sure your information is accurate and displayed appropriately to your patients and colleagues. Now, registration there at the bottom, which right now we have about a 66.6% registration success for invited patients. Now, 66% registration is still very, very good, much above the standard email average of about 5%. We've made an 8% improvement since December by changing the notification message that goes to your patients when they do get invited. So it's much more clear and explicit to the patient that this is a message from Dr. Jones at ABC Family Medical regarding your recent appointment or upcoming appointment or what have you, so that they know what it is. And honestly, the word bright squid is becoming a bit of a verb, and I'll talk more about that in a few minutes. But just by preparing your patients to say, hey, you're going to get a secure mail message and it's going to come to you through this weird system called Brightsquid. That name they'll remember, I guarantee it. And so when they get those messages, they're more likely to click on them. Which brings me to my last point. Recently, we've had clinics hitting as high as 91% acceptance rate on their invitations. There's clinics right here in Calgary that are sending out dozens of invitations a day, and 91 out of 100 of them are being accepted within the first 2 or 3 days that that patient invitation is sent. And that all is tied to the changes we've made and the changes that you can make within your own office to make sure your patients are aware that you use Secure Mail to communicate with them. Here's how we're going to use it, and here's what we're going to use it for. When it comes to Secure Mail, it's mostly used by healthcare providers like yourselves, but most of our users are actually patients. So what does that mean for you for incoming messages and volume of incoming messages? That first bullet point highlights that. 81% of Brightsquid accounts are held by patients, but patients only send about 22% of messages. And I bring that up because one of the main concerns that we hear from physicians especially is, I don't want to open the door to my patients to email me because I'm going to get a million emails from my patients. Truth is, that's not how it works. And honestly, even if it did, I don't know about you, but I'd rather get a million emails than a million phone calls. Those patients that are going to contact you are going to do it whatever way they think is best for them. And if they don't have secure mail, they're just going to phone you. So secure mail makes it better. It's easier to manage incoming secure mail messages than it is to handle incoming phone calls. I feel like I'm really bad mouthing the telephone on this conversation today, and I apologize if it sounds that way, but honestly, it's not the best way to communicate, especially in today's digital age. Most patient messages are just acknowledging that they got the message. So even of those 22% of messages that patients do send, the vast majority of them are, thanks, I got it. At the bottom of this slide, you'll notice that there's that new notification that patients are shown before they send you a message. You may not have ever seen this if you are using the clinic side of the conversation, but this is the message that we show to patients to notify them that secure mail is not a replacement for 911. The last thing that we want to happen is to have a patient sending a message to their doctor hoping to get an immediate or urgent response. So, dear Dr. Jones, I'm having chest pains. What should I do? That's not what secure mail is for. Absolutely, if you're having any issues like that, please call 911 or visit your nearest emergency healthcare facility. Tips for adoption. Really, the best way to get patients to sign up for secure mail is to make sure that they, first of all, want it, which is helpful. Not everyone is digital. Patients of a certain age, I'm not going to say what that age is, may not want to use secure mail, but most people will. Um, so notifying your patients beforehand that you use Brightsquid Secure Mail and here's what we use it for. And you can email them. You can send them a mass email that says, hey, we're going to invite you to use Brightsquid. If you have any questions, let us know. Some clinics have gone so far to print posters, or if you have TV monitors in your waiting room, you can put up a slide on your rotating slideshow about the services that you offer. And you can just discuss it with them either in person or on the phone when they're booking an appointment. Here's that verb I talked about. We're going to bright squid you the information. We didn't come up with this term. It's just something we hear in the community. I prefer to call it Brightsquid Secure Mail, but whatever. If you tell a patient that you're going to send them a message through Brightsquid or over Brightsquid, I'm going to send you a Brightsquid, whatever it is, the great thing about the name Brightsquid, like I said before, is it sticks in your brain. It may sound weird the first time, but eventually it becomes a verb. And not to compare us to the biggest tech company in the world, it's kind of like Google. Yeah, it's. But anyway, I digress. Make sure you let them know that you'll be using their date of birth as the registration code. Also important to note, patients only need to enter their birth date the very first time they log into Brightsquid. After they've registered, we'll never ask for their birthday again. They're going to use a regular password that they will create for their own account after they register. We use Brightsquid because it's better than regular mail for security, and of course, it's way faster than lick-a-stamp postal mail. We're going to send you a document through Brightsquid, or if you prefer, by all means, get in your car and drive down here. And this is where lab requisitions come up. I brought that up a few minutes ago. We're going to send you a document. You don't need to come in and get it. Just pick up the phone, call us, and we can send it to you through secure mail, through Brightsquid, pardon me. You can customize to a certain extent the template of information that you're going to send to your patients. So here's how we're going to use Brightsquid with you. Here's how and when you can communicate with us. Here are our policies and procedures for using secure mail. All of this, not all of this, but some of this is meant to encourage your patient to register, but also to set the expectations they can expect from you and what you're expecting from them. There needs to be some parameters set up, and that's going to vary by clinic. Okay, so I promised that I would do a very quick demonstration of the panel messaging service that I had talked about a few minutes ago. So I'm going to share that part of my screen. So within your Brightsquid account, you may have noticed this little checkerboard icon in the top left-hand corner. This is what allows you to switch between applications within Brightsquid. So if you have access to our appointment reminder service or care plan management, those are add-on features. This is where you would get to panel messaging. Panel messaging, by any other name, is bulk messaging or a mail merge, and it allows you to take a list of patients and a message, smush them both together, and send it out to 100, 200, 8,000 patients at once. And the way that it works is relatively straightforward, where you select a list from your computer, and that's likely going to be a CSV document, a spreadsheet, a list of some sort. And I'm going to pick one here I have prepared called demo file. And this demo file is a list of, I think, 25 or 30 test patients. So we're just going to call this test, 1, 2, 3 test, and then save that. And so here's my new list of patients that I've just uploaded. As I mentioned, it's 22 fake made up people, and I've got their email address here. For some of them, I have an SMS phone number. I have their birthdays, again, all fake people. And here's some other information. You'll notice that some of them are highlighted in red. That's because there's an issue with their contact information. So for Kale here, his email address is not valid. So I can delete him or I can fix the problem like so. For other patients that are highlighted in red, you'll notice that some don't have any contact information. The idea here is that I want to vet this list to make sure that I've got an appropriate contact list for each person. Once I've got my list of patients available to me, then I create a campaign or I reuse a campaign that I want to send to those patients. So I have this welcome message here, welcome message demo, and this is the message that's going to go to those patients. Now, of course, if you're familiar with Secure Mail, patients get a regular old-fashioned email that invites them to link into Secure Mail. In bulk messaging, we also offer SMS text messaging to patients. If you don't have SMS text numbers, don't worry about it. You can skip over this section. And you can also include secure content. So this would be the secure mail body of the message that we're all used to with a regular secure mail message and any attachments. So this is the actual secure message that the patient will see after they've registered. Once I've created all that information, I merge my campaign with my new list of patients, test, and I can send that out. And I can send this message out to, in this case, a list of 22 patients or a list of 222 or 2,222. And we can send all that out in just a matter of minutes, as opposed to entering all that information manually. I do want to take a look into the questions section. This actually came in earlier ahead of the conversation, which is, what about those patients that don't want to use secure mail? As I mentioned in one of my slides, our acceptance rate is somewhere between 66 to about 90%. You're never going to find a solution that satisfies 100%. But if you can get even 25 to 30% of your patients using secure mail, I promise you that you will see a drop in the amount of time that you're spending on the phone. I know not everyone actually tracks phone time in their clinics, but those that have told us that they've saved as much as 25 to 30% of phone minutes in a month because they had deployed secure mail. Not everyone loves new technology. Most people do. But if you can even get a reasonable portion of your patients to use secure mail with you, you'll find yourself saving time and it becomes a virtuous circle. The more patients that you have on secure mail, the more ways you'll find to use the service, the more patients that you'll invite, and the more they'll use secure mail with you. And it just gets better and better from then.
Another question we get asked a lot is, what if patients are adamant about using traditional old-fashioned non-secure email and refuse to sign up for Brightsquid Secure Mail? Is it then okay to use email with that person? The answer is still no. Never forget that patients don't have the ability or the authority to absolve you of your obligations to the health legislation regulations in your jurisdiction. So whether that's the Health Information Act or PIPEDA or HIPAA in the United States, patients can't just sign a thing and says this clinic is no longer beholden to these rules. You're still the one who's responsible for protecting healthcare information and the one who will be held responsible if information is leaked.
So that's all the time that we have today. I don't have any more questions in the queue, so I'm going to wrap it up. If you have any other questions, you can always contact me or our support department by going to support.brightsquid.com or just send an email to support@brightsquid.com. Thanks very much for taking the time to listen to me today. Have a great afternoon, and we'll see you next time.